Hi, my name is Kelly Hunt, and I'm a family nurse practitioner here in Southern California. I chose a career in healthcare because I genuinely have always wanted to be able to help others. I wanted a career that would fill me with a sense of purpose, um, and also where I would be challenged every single day, forced to continuously learn, and last but not least, in doing all of that, hopefully leaving the world a little bit better than how I found it. I started off my career as a registered nurse at a local hospital on the cardiac floor. And then eventually I transitioned down to the emergency room where it's probably one of the most incredible experiences I've ever had in my career. The team that I work with were absolutely incredible. They taught me so much, lessons that I remember to this day, and really kind of guided me through being able to work in such high stress situations. I eventually became a float nurse and were taking care of patients that were serious codes, and it was absolutely, it was incredible. Um, One of the things that I quickly started piecing together when I was in the emergency room is a lot of patient visits were preventable. Um, People that were not getting to their primary care providers for those annual wellness exams and their physicals. You know, a lot of their illnesses could have been prevented. And it was for that reason and quite a few others that I decided to become a family nurse practitioner. And I chose Georgetown University. It was the only school that I applied to because their morals really, really spoke to me in regards to social justice and just, healthcare for everyone. Um, so I attended Georgetown University for my nurse practitioner program, and upon completing my program, I decided to work in a community clinic, a federally qualified healthcare center, with patients that either don't have insurance or that have Medicare, Medicaid. Um, I'm still there almost 2 years later. It's it's been extremely hard work, but so very rewarding. It's definitely filled me with a sense of purpose, and has also forced me to be very creative, in my role when patients don't have insurance and I'm just not able to refer them to a specialist. I sometimes have to get very creative with the care that I provide and utilize different resources, and just reach out to whoever you can to try to help these patients that otherwise would not be able to get care. It's really a beautiful thing. It's hard work. Some of my hair is definitely gray after practicing for a few years, but it's been incredible. I wouldn't trade it for anything else in the world. Um, Fun stuff about me, I have two little Yorkies that I absolutely love to snuggle and de stress with during lunch. My go to songs, if I'm really looking to get pumped up, would probably be, a good Taylor Swift Shake It Off, or maybe even some Katy Perry Roar, something to just kind of put you in that mindset to conquer the day. I truly believe in having fun at work. Sometimes we have dance parties when we just need to shake it out. I try to always bake for my team. I have learned that baking goods and bringing it to work usually puts people in a really good mood. So it's something that I like to do on an evening where I need to de stress. And regarding my coffee, I'm a huge fan of Hawaii in general. So I do Hawaiian hazelnut coffee in the morning with a splash of salted caramel creamer. But at the end of the day, it's really just about being there for your patients, having fun, and just doing it together. We're all in this together. It's not easy work. So I'll never forget when I first started at my job. I was told that I couldn't wear scrubs, and I slowly chipped away at them. And now myself and many others wear figs to work every day.